A lot of the patients that I see in my practice who have incurred stroke, it is actually caused by diabetes. And although many are aware of the common symptoms of diabetes such as frequent urination and frequent thirst as well as fatigue, not many know that diabetes can also give signs in our skin. That's why in this video, I'll be sharing with you top 10 skin conditions that will help determine or will tell you that you have high blood sugar level. Stay with me until the end because the last two symptoms are very common, but a lot are not aware that it is your body's way of telling you to have your blood sugar level checked. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you will surely benefit from. Without no further ado, let's get into it. Yellow, reddish, and brown patches on the skin. High blood sugar can actually cause bumps that looks like pimples, but as it worsens, this becomes thick, and then this is red usually in color, and the surrounding structure is shiny in appearance or porcelain-like. This is actually called necrobiosis lipodica. It is itchy, it subsides, and comes back again whenever your blood sugar level is high. Digital cirrhosis. In 1/3 of patients with type 1 diabetes, they actually experience this, where there is thickness, tightness, and waxy texture in the palm of the hands. The muscles of the hands are also affected. They find it difficult to move. Usually, this can also affect the ankles and the knees. Only way to beat this or to control this symptom is to lower blood sugar level or to use moisturizer. Physical therapy can also help to improve range of motion. Blisters. It is rare, but it usually happens with high blood sugar level as well. Having diabetic neuropathy, wherein the nerves are damaged due to poorly controlled blood sugar level, actually increases one's risk of developing diabetic blisters. Good news though, because these diabetic blisters are actually not painful. They usually subside after several weeks, but then proper treatment is still needed to prevent infection. Open wounds. High blood sugar level can actually cause poor blood circulation and nerve damage. And since proper wound healing would require proper blood circulation, you can expect that wound healing time will be longer. In fact, the wounds that are most affected are the wounds that are found in the feet because it is farthest from the heart. In the case of open wounds, or what we call as diabetic ulcers, it needs to be treated well. We need to avoid blackish discoloration of the skin because this means the tissue is already necrotic and there is no blood circulation anymore, in which case surgical removal of the body part may be needed to prevent further infection, which is called sepsis and which can be life-threatening. If you think that this video or this channel is helpful, I would really appreciate it if you can take only 1 second of your time to please click the like button below as your way of supporting this channel. Thank you. Bacterial skin infections. Although many of us can be affected by this, but it commonly affects those who have high blood sugar level. And the body parts most commonly affected are actually the eyelids and the nails. The other surrounding surface can be painful, it can turn red, and it can be inflamed. In this case, antibiotic or antibiotic creams, it can be very helpful. Shin spots. This is actually very common for both type 1 and type 2 diabetes. There are small round, pink, reddish, or brown patches in the skin which can be confused as age spots. But the difference, they can sometimes be indented. These patches in the skin commonly affects the lower leg, or what we call as the shin bone. And although these are not painful, it can stay there for 1 to 2 years, and in some cases, it stays permanently in the skin. Eruptive xanthomatosis. Elevated blood sugar can cause eruptive xanthomatosis. These are firm, yellow, pea-like rushes or skin growths in the skin, and they are itchy. They are usually found in the back of the hands, the feet, the arms, and buttocks. And this skin problem affects young men with high cholesterol level. Treatment plan for eruptive xanthomatosis is to lower both cholesterol and blood sugar level. Granuloma annulare. Elevated blood sugar can lead to raised, bumpy, or ring-shaped spots that are color red or red-brown, and this causes mild itching. This rash usually disappears on its own without leaving scars. If you notice this type of skin condition that comes and goes, have your blood sugar level checked because sometimes this can be a sign of pre-diabetes. Extremely dry, itchy skin. Although there are many reasons why you may have itchy skin, but for those who have high blood sugar level, dryness in the skin can be attributed to poor blood circulation or either an infection. To help control this, be sure to lower your blood sugar level and then use mild soap and moisturize, but do not put it in the skin between your toes. Darker area of skin. A dark, thick, and velvety patch or band of skin that can commonly see at the back of the neck, the armpit, and the groin could mean too much insulin in the blood. This diabetic skin problem usually develops in people who are very overweight. There's no cure, but losing weight can improve the skin's appearance. If you have the skin problem and haven't been diagnosed or haven't had your blood sugar level checked, talk to your doctor because this is usually appears before diabetes strikes. In conclusion, these are the 10 common skin problems that you can see if you have high blood sugar level. If you have experienced any of these symptoms, please have your blood sugar level checked so you will be guided better by your doctor. If you want to know about proper treatment protocols on how to exercise if you have high blood sugar level to prevent hypoglycemia, I have a video here. Please check on it. It will really help you. Thank you very much for watching. Should you have any questions, please comment down below because I would really get back on you. If you have reached the end of this video, please comment healthy in the comment section below. I would really love to hear from you. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you.